Hello everyone, let's learn today bony features and attachments of the scapula. Now this is right scapula, and as you know it's a triangular shaped flat bone. It is also called as shoulder blade, and it is a part of pectoral girdle. So along with the clavicle, the scapula and clavicle together they form pectoral girdle. Now let's see the external features. The scapula has got two surfaces, costal surface and dorsal surface. It has got three borders, superior border, medial border and lateral border. It has got three processes, the spinous process, the acromion process and the coracoid process, and it has got three angles, the lateral angle or glenoidal angle, the inferior angle and the superior angle. Now the scapula extends from second rib to the seventh rib in posterolateral aspect of the thoracic wall. Now let's see the individual features. First see the costal surface. Now costal surface is facing forward and medially, and it has got a depression, and this depression is called as subscapular fossa. Now if you see the costal surface closely, you will see 3 to 4 oblique ridges running from medial to lateral towards lateral border. Now medial two-third of this subscapular fossa, it provides origin to subscapularis muscle, and these ridges are providing attachment to intramuscular septa, and these septa are providing additional surface area so as maximum number of fibers can be accommodated. So subscapularis is an example of multipinnate muscle. Now let's see dorsal surface. Now dorsal surface is subdivided into two fossa by a spinous process. This is spinous process. So a smaller one is the supraspinous fossa and a larger one is the infraspinous fossa. Now medial two-third of the supraspinous fossa along with the superior surface of the spine provides origin to supraspinatus muscle, whereas the medial two-third of infraspinous fossa along with the corresponding inferior surface of the spine, it provides attachment to the infraspinatus muscle. Now laterally, this supraspinous fossa is in communication with infraspinous fossa. Over here you can see through a notch, and this notch is situated between this glenoidal angle and spine, so as the name given is spinoglenoid notch. So there is a connection or communication between the supraspinous fossa with the infraspinous fossa, and suprascapular nerve and vessels from supraspinous fossa, they pass through this spinoglenoid notch and to enter into the infraspinous fossa. Now let's see borders. First is the lateral border. It is very thick and it is also called as axillary border. Now it extends from the glenoidal angle above to the inferior angle below. Now just below the glenoidal angle, the lateral border bears a tubercle which is termed as infraglenoid tubercle, and this is providing origin to long head of triceps brachii muscle. Now below to that, the lateral border along with the infraspinous fossa, it forms a flat bony strip. You can see over here, and this flat bony strip along with the lateral border in upper two-third, it provides origin to teres minor muscle, and below there is an oblique ridge. You can see over here in the flat strip. So below that oblique ridge, this portion provides origin to teres major muscle. Now if you see the lateral border, within the origin of teres minor, there is a notch, and this notch is lodging circumflex scapular vessels, and that is going towards the infraspinous fossa. Now infraspinatus fascia, it covers infraspinatus muscle and teres minor muscle, and the fascia is attached to this spinous process and to entire infraspinous fossa excluding the teres major muscle. So this oblique ridge provides attachment to infraspinatus fascia, and in the injury to or fracture to the scapula, there is a formation of hematoma which is limited to the territory of this infraspinatus fascia. Now the costal aspect of the lateral border is very thick, and this is behaving as a lever for the action of serratus anterior muscle. So during various movements produced by serratus anterior muscle, the lateral border, which is thick, it is behaving as a lever. Now let's see medial border. It is also called as vertebral border because it is related to the vertebral column medially. It extends from superior angle to the inferior angle, and along its costal aspect it bears a thin bony strip. You can see over here. This thin bony strip above and below becomes little bit raised and triangular. You can see over here the raised medial bony strip. Now superiorly, the rough elevated area which is broken over here, it provides attachment to first digitation of serratus anterior. The second and third digitation are attached along this medial strip of the bone, and lower 5 digitation of serratus anterior, they are attached in this lower raised area. So this is how the 8 digitations are attached along the costal aspect of the medial border. Now if you see the dorsal aspect of the medial border, at the level of the spine of third thoracic vertebrae, along the medial border there is a triangular area, and it coincides with the apex of the spine. So this is the apex of the spinous process, this is spinous process, and this is the apex. So there is a triangular area at the level of third thoracic vertebrae. So in the dorsal aspect, from superior angle to the point which is related to the apex of the spine, this portion provides insertion to levator scapulae muscle. The portion of medial border along its dorsal aspect against the apex of spine, this portion provides insertion to rhomboidus minor muscle, and remaining dorsal aspect of medial border, this portion provides insertion to rhomboidus major muscle. Remember, the minor comes first. So along the medial border there will be rhomboidus minor and rhomboidus major. Along the lateral border there will be teres minor and then teres major. So along the medial border, on costal aspect there is serratus anterior. Along the dorsal aspect there is levator scapulae, rhomboidus minor and rhomboidus major. All 4 muscles are inserted. So we can say that along the medial border the muscles are inserted. Just opposite to that, along the lateral border there is origin of long head of triceps, teres minor and teres major. So we can say that lateral border provides origin to the muscles. Now let's see superior border. It is thin and short, and it extends from superior angle to the gnudal angle. So this is superior border, which is bit broken over here because it is very thin, and this is coracoid process. So near the root of coracoid process, the superior border shows a notch, and this notch is termed as suprascapular notch. Now this suprascapular notch is converted into a foramen by suprascapular ligament, and through this foramen the suprascapular nerve enters in the supraspinous fossa, whereas the suprascapular vessels, they pass above the suprascapular ligament. So this is how the suprascapular nerve and vessels, they reach to the supraspinous fossa. Here the suprascapular nerve will supply supraspinatus muscle, and then it enters into infraspinous fossa through this spinoglenoid notch. Again this notch is converted into a foramen by spinoglenoid ligament. Now the suprascapular nerve supplies infraspinatus muscle. So a single nerve, suprascapular nerve, supplies 2 muscles, supraspinatus and infraspinatus. Now near suprascapular notch, the superior border over here provides attachment to inferior belly of omohyoid. Now omohyoid is an infrahyoid group of muscle, and it is supplied by branches of cervical plexus. Now let's see angles of the scapula. As I mentioned, there are 3 angles: lateral angle or gnudal angle, inferior angle and superior angle. So let's see first the lateral angle or gnudal angle. It is also called as head of the scapula, and rest of the portion of scapula is termed as body of the scapula. Next to the margin of gnudal angle, there is a constricted part, and this constricted part is termed as anatomical neck of the scapula. Now if you see the gnudal angle, it is pear shaped, it is narrow above and broad below, and it is a shallow depression which is in living covered by articular cartilage or hyaline cartilage, and that provides socket for the head of the humerus, and together they form shoulder joint. Now above the gnudal angle over here there is a tubercle at the root of the coracoid process. This is termed as supraglenoid tubercle. So above the glenoidal angle we have supraglenoid tubercle, and below there is infraglenoid tubercle. Now this supraglenoid tubercle provides origin to the long head of biceps brachii. Now the margin of gnudal angle provides attachment to a fibrocartilaginous rim, which is termed as glenoidal labrum, and that increases the depth of the gnudal cavity. The attachment of gnudal labrum excludes supraglenoid tubercle. Now outside the attachment of gnudal labrum, there is attachment of fibrous capsule, and that fibrous capsule is for the shoulder joint. Above it includes supraglenoid tubercle, so as the long head of biceps will become intracapsular, whereas below it excludes infraglenoid tubercle, so as long head of triceps will become extracapsular. Now if you see the articulation, this is head of the humerus, which is again smooth, and that is covered by articular cartilage, and these two are articulated like this to form the shoulder joint. The gnudal angle is directed laterally, forward and upward. So if you see it from in front, the direction of gnudal angle is lateral, forward and upward. Now if you see the lateral angle from in front, this portion, that is the part of the neck of the scapula, this portion is devoid of attachment of subscapularis, and over here there lies a bursa deep to the tendon of subscapularis, which prevents friction. Similarly, posteriorly or dorsally, this portion of the neck, it is again devoid of attachment of infraspinatus. Now if we draw an imaginary line extending from suprascapular notch above to the infraglenoid tubercle in front, and the same line from infraglenoid tubercle to the suprascapular notch above, this continuous line is termed as surgical neck of the scapula, just because this portion is more vulnerable for fracture as compared to the anatomical neck. The fracture of anatomical neck are very rare. Now the superior angle is a meeting point of superior border and medial border. It is deeply placed and it is covered by trapezius, and deep to the trapezius there runs spinal accessory nerve. So two structures are related to it. Now let's see inferior angle. It's a meeting point of thick lateral border and medial border over here, and dorsally you can see the triangular flat strip also encroaches the inferior angle. So portion of teres major and few slips of latissimus dorsi are attached to it, and on the costal aspect the lower 5 digitations of the serratus anterior are attached to it. The inferior angle is approximately situated at the 7th rib or 7th intercostal space. Now let's see processes. You know there are three processes: spinous process, acromion process and coracoid process. Now let's see first the spinous process. The spine or spinous process has got an apex, a base or lateral border, an anterior border which is attached to the dorsal surface, a posterior free border which is subcutaneous, it is called as crest, a superior and an inferior surface. The apex is situated at the level of spine of T3 vertebrae, and near apex it presents a triangular area over which the lower fibers of trapezius glide, and between trapezius and bone there runs a bursa over here. The base or lateral border, it is free and that forms spinoglenoid notch with the glenoidal angle. Now the posterior border, it is also called as crest of the spine. It bears two lips, upper lip and lower lip. The upper lip is continuous with the medial border of acromion process, whereas the lower lip is continuous with the lateral border of acromion process. So there are two lip, upper lip and lower lip of crest of spine of scapula. The upper lip along with the medial border of acromion process, it provides insertion to middle fibers of the trapezius, whereas the lower lip of the crest of the spine, it provides origin to posterior fibers of the deltoid. Now at the commencement of lower lip near apex, this portion, it is elevated rough and it is called as deltoid tubercle, where the lowermost fibers of the trapezius, they converge and they are inserted. Now let's see the acromion process. It projects forward as a flattened plate from the lateral end of the spine of the scapula. The acromion process has lateral border, medial border, a tip, an acromion angle, dorsal surface and undersurface. The acromion angle is the meeting point of lower lip of crest of spine of scapula with the lateral border. So this is acromion angle. The tip will be in front, that is meeting point of medial and lateral border. The dorsal surface is subcutaneous. The undersurface is related to the tendon of supraspinatus. Between supraspinatus and the undersurface, there is subacromial bursa. Now let's see the medial border. It's a continuation of upper lip of crest of spine of scapula, and along with the upper lip, it is providing attachment to the middle fibers of the trapezius. Now anteriorly, the medial border bears a flat articular surface and that forms acromioclavicular joint with lateral end of clavicle. Let me join both. So this is right clavicle and at the lateral end there is a flat impression and together these two will form plain synovial joint, that is acromioclavicular joint. Now the lateral border of the acromion extends from the acromion angle to its tip and it provides origin to middle fibers of the deltoid. Now along this border, if you closely see, you will find four tubercles. Now these four tubercles are providing attachment to fibrous septa and these fibrous septa in turn will provide origin to the middle fibers of the deltoid. So by fibrous septa, the surface area will increase and it can accommodate maximum number of muscle fibers. So middle fibers of the deltoid is also an example of multipinnate arrangement of the muscle. Now tip of the coracoid process, it provides attachment to a ligament that extends from coracoid process to the acromion process, that is termed as coracoacromial ligament, and laterally it is attached to the tip, whereas medially it is attached to the posterolateral border of the horizontal part of coracoid process. The coracoid process has horizontal part and vertical part. The horizontal part has posterolateral border. So over here there will be attachment of coracoacromial ligament. So along with the horizontal part, coracoacromial ligament and the undersurface of the acromion process, these three structures are forming a continuous arch and this arch is behaving as a hood-like protection for the shoulder joint. Now let's see coracoid process. It's a beak-like or bent finger-like projection at the junction of superior border and glenoidal angle over here, and it resembles like a bent finger like this. So it has got lower vertical part like this and upper horizontal part. Let me correlate. This is lower vertical part and upper horizontal part. So this is coracoid process. It is directed forward and laterally. The vertical part is related to subscapularis in front and supraspinatus muscle behind. So this is supraspinatus fossa. So here will be supraspinatus and this is subscapular fossa. So here will be the subscapularis. The horizontal part, it is directed forward and laterally and it has a tip, anteromedial border, posteromedial border, superior surface and inferior surface. The superior surface and adjoining anteromedial border over here. This area provides insertion to pectoralis minor muscle. The rest of the anteromedial border, it provides attachment to coracoclavicular ligament, its trapezoid part and conoid part. The posterolateral border, it provides attachment to coracohumeral ligament, which extends from coracoid process to the joint capsule of the shoulder joint, and over here it provides attachment to coracoacromial ligament. So that forms coracoacromial arch. The tip of the coracoid process provides attachment to two muscles, medially to the coracobrachialis and laterally to the short head of biceps brachii. So entire coracoid process provides attachment to three ligaments and three muscles, namely coracoclavicular ligament, its conoid part and trapezoid part, coracohumeral ligament and coracoacromial ligament, whereas three muscles over here will be insertion of pectoralis minor and from tip coracobrachialis and short head of biceps brachii. Now we know the superior surface of the coracoid process provides insertion to pectoralis minor muscle, and posterolateral border provides attachment to coracohumeral ligament. So coracohumeral ligament is considered as degenerated part of tendon of pectoralis minor muscle. Now let's see certain important features regarding scapula. Scapula is an example of composite bone and it is formed by fusion of ventral element and dorsal element. The ventral element is represented by coracoid process and tip of the coracoid, which is called as epicoracoid, whereas dorsal element is represented by rest of the scapula. And as a rule, the muscles attached to the ventral element to the coracoid process and precoracoid should be supplied by ventral division of brachial plexus, and muscles attached to the dorsal division should be supplied by dorsal division of brachial plexus. But there are three exceptions. Number 1, inferior belly of omohyoid. Number 2, trapezius. And number 3, levator scapulae. Now these muscles are basically belonging to the trunk, but functionally they have been shifted or migrated to the pectoral girdle. So they are not supplied by brachial plexus. Now we know the scapula is homologous with the hip bone, and hip bone has got three parts: ilium, ischium and pubis. So body of the scapula is homologous with the ilium. The coracoid process except tip. The coracoid process except tip plus upper one third of the gnudal angle. That portion is homologous with the ischium, whereas the tip of the coracoid process or the precoracoid element, it is homologous with the pubis. Now in lower animals like reptiles, the coracoid process is a separate bone. So it is an example of atavistic epiphysis. So this is regarding scapula. Hope you understood well. Thanks for watching.